all of us have a capacity to slow down the aging process or the pace at which we are aging. Men in that age group think, work throughout the night and I can get away with it. But what is the ultimate result? He had lesser testosterone levels, which will make him put on more weight. If you talk about level 1 longevity, these are people who have more than 2 lifestyle diseases, metabolic diseases.
What level 4 could look like?
Level 4 is somebody who is, all of us will age and all of us will end up with age-related diseases. Then in that sense, longevity is for everyone.
Can you tell me the difference between those one-time or limited time consultations versus what you're doing now?
Many people come up to a doctor when they have a problem and they expect a one-time prescription. But what about the root cause that is creating the problem? Here today, in longevity medicine point of view, all of us have solutions for these questions.
Why are other tests required when I know what disease I have is something that I often hear when interacting with clients.
I'm seeing a very bigger challenge with the new age tests that are available outside and people do them.
How will longevity journey look like for people who already have diseases for so many years?
An individual having type 2 diabetes for 15 years, their cellular function can be enhanced. All of us should be empowered to know what we are at risk for because we can take action starting from today. In late 20s, early 30s, I've been seeing people having metabolic dysfunctions. They are at risk for osteoporosis, they are at risk for diabetes, hypertension. When I see that all these can be preventable, then why not?
When we first started building longevity protocols a couple of years ago, no one was talking about longevity at that point in time, right? But today, if you see, gyms are also talking about longevity, and it's like very fragmented. And also, it feels like it's just for peak performers, right? So, how are we looking at longevity differently from how the world is looking at longevity?
When we talk about longevity is often perceived as a very exclusive, top-notch club, a very exclusive club, right? But what we are trying to redefine is longevity is for everyone. It's a very inclusive game because let me tell you, all of us go through aging. All of us will age and all of us will end up with age-related diseases. Then in that sense, it is for everyone. But everybody is in different stage of the game. Somebody could be having a disease. So for them, reversing a disease in itself will reduce biological age. For somebody, they do not have a disease, but they do have some dysfunctions at the cellular level. For them, optimizing is a very next stage. For some people, they are already optimized for their age, but they want to enhance their productivity and performance. Then there is a next level for them. So I think I would like to look at longevity as different levels where people keep crossing from level 1 to 2 to 3 to 4. But everybody is in some level trying to move to another level. Longevity is a continuum that way. It's the journey that all of us will go through and it's not a one time in point and where you suddenly feel like, now I want to up the longevity game, but I want shortcut solutions. That is not going to happen. So we need to set up foundations very strong. It is stress management, exercise, movement, nutrition, sleep, purpose in life, and social connections. I think these are all the elements of longevity that all of us should lay foundations for and keep building on top of that is what I feel and how I look at longevity.
When you say levels, can you explain what level 1 could look like and what level 4 could look like and who are there in these levels?
So if you talk about level 1 longevity, who are these individuals? These are people who have more than 2 lifestyle diseases, metabolic diseases, for example, hypertension, diabetes, coronary artery disease, or high uric acid levels. So these are the individuals who fall in level 1. Level 2 could be any individual who's having at least one metabolic disease in last 5 years of their life, and they're trying to reverse it. And then comes level 3, wherein they don't have a diagnosed metabolic disease yet, but they have some abnormalities or aberrations in their biomarkers. Like their biomarkers are not in their optimal zone. They are little suboptimal. If they can align that, they will reach their optimal health. And level 4 is somebody who are all optimized, like nutrition levels are optimized and their muscle to fat ratio is good and their bone mineral density is good. They have good arterial and all other critical vital organs very well. but their only purpose, next purpose would be to enhance their productivity, to enhance their performance. So that could be something like level 4. If we start putting people in these levels, then we know what could a journey for a given individual be like. So journey could be for a level 2 person, reversing the disease that they have. For level 3 person, further optimizing their nutrients, or further optimizing their inflammatory markers and others. So I think it's a journey for everybody to have. It's just that the starting point is different. So we need to reach them wherever they are, and we need to handhold them and move forward in their journey so that they could be reversing a disease, optimizing their health, or enhancing the resilience, or enhancing their performance.
Got it. So for these individuals who are, say, for example, in level 1 or level 2, who know that they have certain metabolic conditions, say diabetes or hypertension, etc. But most often they still ask, I know I already have diabetes. I know I already have, hypertension, but why are so many other screening mechanisms, or, why are other tests required when I know what disease I have? Is something that I often hear when, I'm interacting with clients. So can you explain?
So, people commonly know if they have a disease, they need treatment for that particular disease, they need diet plan to address that particular problem, and they need medications to address that particular problem. But from the longevity lens, what we're trying to make people understand is most of the problems, for example, diabetes, hypertension, cardiovascular diseases, cancers for that matter, all these stem from root causes of aging in itself. So they all need to be addressed in a certain way. I can't give a diet, one kind of a diet for diabetes, one kind of diet for hypertension. I should personalize it for you depending on your nutrient levels, depending on your circadian rhythm, depending on your work life pattern, depending on where your physical activity and your exercise levels are. And if you have inflammation, oxidative stress, are you exposed more to external toxins? Is your liver detoxifying enough? Or how is your gut? So, whatever disease you could be having, if I'm not going to fix these root causes, I'm not going to address your disease from the longevity lens point of view. So, we are not going to treat problem in a very surface level. Here, we are not going to treat just symptoms alone. What we are trying to address in longevity is addressing the root causes. So, that's why you could be coming up with a problem of high uric acid, but we would still want to analyze how your gut health is, metabolic health is, inflammation is, and your nutrient levels are. So, despite what disease you can come up with, most of the time, metabolic or lifestyle diseases, we do end up assessing individuals in all these variables that we are talking about. So, I think that is where we need to change the lens and look at metabolic disease little more openly, widely, that there are several root causes to it, and we need to address all of them.
Got it. And I think even to address all these problems, earlier I think you were spending very less amount of time with the clients, but now I think you are more involved. Your team is more involved. Can you tell me the difference between those one-time or limited time consultations versus what you're doing now? What is the difference that you're making?
Yes, many people come up to a doctor when they have a problem. That is rightfully so, because they're sick, they have a problem, they know it, and they come to the doctor and they expect a one time prescription. See, that one time prescription will solve the acute problem. Okay, the acute pain or acute headache that they have then will be addressed. But what about the root cause that is creating the problem? What should the individual go back home and start following so that he will not end up with the doctor again and sick with the same symptom? If that root cause is not addressed, then one time consultation is not going to address that. So, since we are about fixing root causes, we are not about giving symptomatic relief. I think we have to work with individuals in a very participatory model. Unless we work together, I wouldn't understand how a nutritional change that I have given you is impacting you and how you are reacting to it. I wouldn't understand if you cannot get back to me. But should I wait for 1 month for you to get back to me? There is so much more that can happen in 1 month, right? You could feel the difference within a week. If you're changing your diet completely today, you would feel a change in your sleep. You would feel a change in your mood, your energy levels, and how you're feeling about things around you. how anxious you are. All these changes do happen in days' time or in weeks' time. So, in that scenario, if you look at it, active feedback is very important. Gone are the days where we ask people to come back after 3 months, come back after 6 months, so that we can see a change in biomarker. For the change to happen at the blood level, we have to wait for a certain period of time so that cells will undergo a change, organs will undergo a change, then the blood will reflect at the end of 3 or 6 months. But in today's time, where the science and medicine is at a faster pace, we need not wait for things to happen for too long. We can always use the time to get active feedback, either from the wearables that you're wearing, from the symptomatic questionnaire that we use, how your mood is, digestion is, how your energy is, and also we can from the other variable markers, for example, how your HRV has changed over days, and how your resting heart rate has changed over days, how is your deep sleep, how is your REM sleep. So there are still markers like this which are very non-invasive and can give active feedback within days time, and we need not wait for months together to make a change and look for a change to happen in blood biomarkers. So I think that is the way we look at personalized medicine, where you give changes and take feedback actively and keep changing it back to optimize and improve things faster and not slower.
Got it.
Yeah.
Circling back to what you said, even if someone is coming with diabetes, you still want to check their gut health. You still want to check their vitamin profile. But yeah. But these tests have been available in the market through diagnostic centers or regular hospitals for years, right? All these like full body checkups, etc. So how are longevity markers, or how does longevity look at these tests differently from conventional way?
I'm seeing a very bigger challenge with the new age tests that are available outside, and people do them as a single time test and try to get all the diagnosis in a single test. That is a problem. Uh, because if you don't connect the dots, if you look at the single test, you wouldn't get that picture. See, for example, I'm just looking at the gut microbiome report of an individual and I don't know anything about the individual. I don't know what they eat. I don't know what kind of lifestyle they lead, if they have stress, if their inflammatory markers are high, if they're under oxidative stress, how their metabolic function is. If I don't understand any of that and look at simply gut microbiome report, it cannot make sense and connect the dots. So it's all about connecting the dots and making good interpretations, and insightful results should come out of it. There are some tests which are called diagnostics tests.
Right.
That means if you do a test, if it falls under certain range, it is indicative of a certain disease. That is a diagnostic test. There are other tests called screening tests. So you get those tests, you're screened for something, that means it leaves a question mark. It could be number 1, number 2, or number 3. Then you go do all these 3 tests to see where or which diagnosis you fall into. So some tests are screening tests, some tests are diagnostic tests. So we need to ideally screen through and get through a physician to understand what diagnosis to be made. I think that is very crucial. I think this is what people are missing out. When they do a single test and the dots are not connected, they are not going to find solutions. If you think you do a test and you see all the solution in a single test, then what is the purpose of testing for gut, testing for oxidative stress, testing for uric acid or metabolic markers, right? If you're not making connections, I think then we are losing out. This is called systems biology approach, where you address every system, optimize every system, balance at every system, so that the end changes. If they have higher uric acid levels, it comes down. If you have essential hypertension, your blood pressure levels are managed. If you have type 2 diabetes problem, your blood sugars are optimized, or even your blood sugar medications dose might come down. So what is the ultimate goal? Ultimate goal is to reduce the number of pharmaceutical drugs that we need to take to address a given condition. So for that, we need to make all other additional changes that I'm talking about. Or if you're not having a disease, you're borderline, if you have a borderline prediabetes, for example, you can clearly reverse it, and there's a higher probability, higher chance of you reversing the disease. Reversing the disease in itself is decreasing biological age.
Right.
So all of us today have a capacity to slow down our aging process, because some or the other pathway in us is little faster and is aging us. And if we know which pathway is that, today we have solutions to slow down those pathways. It could be high intensity interval workout for some people. For some people, it could be simply improving omega 3 or polyphenol rich foods. For some people, it could be toning down on the excessive strength training that they are doing. It could be toning down on the excessive protein intake that they are taking. Or for somebody, it could be even improving the protein intake because they are taking less protein. And for somebody else who has not been strength training in their life, it could be strength training in some. So it is different things for different people, whatever they were not doing or not aligning with. If we can optimize them, all of us have a capacity to slow down the aging process or the pace at which we are aging. End result is we may not have to suffer with early onset aging related diseases or lifestyle related diseases, for example, osteoarthritis, osteoporosis, diabetes mellitus, hypertension, coronary artery disease, high uric acid, the things that we all suffer from. The India is suffering with lot of these non-communicable diseases. That burden, overall burden, can be reduced.
You just mentioned if someone has a borderline hypertension, it can be easily reversed. But how about people who've been like living with diseases since, say, past 10 years or something like that? How will longevity journey look like for people who already have diseases for so many years?
Let me take two scenarios here. An individual having a type 2 diabetes for over 15 years and for an individual over 10 years. If you look at them, for an individual who is having a diabetes since 15 years and not maintaining glycemic control, which is they're not maintaining their blood sugar balance very well, that means they have already caused microvascular damage. That means it could have affected their eyes, their kidneys, their peripheral nerves, etc. So for them, from longevity lens, if the longevity lifestyle is applied and the nutrition is applied and the root causes are balanced, their cellular function can be enhanced. They can feel better in terms of their mood, energy, and sleep and digestion. Of course, the probability of reversal of the disease could be lower for them. Or even sometimes reversal may not be possible. But there is larger probability of them improving their cellular function and henceforth reducing the doses of drugs they have been taking. That is a great success story for them. Now let's take a second scenario where the individual has diabetes since type 2 diabetes since 10 years and have been having pretty good glycemic balance, and we are now started looking at them in a longevity lens and started giving them longevity diet, lifestyle, exercise, everything. Their probability of reversal is moderate, but the cellular function gets better. They'll feel better in terms of their symptoms. They'll get rid of dependence, their drug dosages, and they'll feel better, a lot more functionally, cognitively better. So again, if you take a third scenario where the individual is having diabetes just since 5 years and have been having good glycemic control, their reversal of disease is much higher.
Got it.
So the reversal of the disease depends on how long a client has been suffering from and how well they have been managing. Both of these will play a role. But we can definitely improve their mitochondrial function. They can definitely feel better in terms of their mood, cognition, and their muscle health. All these we can still work on.
Got it. So if I imagine longevity to be like a mountain, because there are multiple levels to it and it's a journey, what could the summit point feel like or look like?
The ultimate goal of health is different for individuals, for different individuals. For some people, it could be just being very functionally independent. They may not want to climb Mount Everest, but they want to spend good time with their family and have good stress resilience. That could be a health goal. For somebody else, health goal could be, I just want to reverse my disease. For somebody else, it could be, I want to climb Mount Everest and feel my best, top of my game. I want to feel cognitively the best and face multitask challenges very easily. So health goals are different for different people, but ultimately it is with good cognition, good muscular strength, good VO2 max, good insulin sensitivity, as much as possible low inflammation, good gut health, and good brain function. So this is what all of us want, right? For example, there's been this recent article about founders, creators, and high performing entrepreneurs. They perform multiple tasks and they want to be on the top of the game, and they want their productivity productivity to be very high because they are taking very important decisions throughout the day. So for them, the recent changes that they have made in their lifestyle nutrition is improving their productivity and they are feeling the best in their lifetimes. And what are these changes? They're optimizing their sleep, they're working on their last meal, they're quitting alcohol and smoking, and they're eating the best things, for example, including dietary fat, increasing their protein consumption if they have not been optimized before, focusing more on strength training, working on neuroplasticities, like doing or learning things that they have not been doing all their life, and adding a thing which they're more passionate about. For example, it could be their hobby of painting, whatever it is. So doing all these things, having a purpose in life, having more social connectedness will definitely improve whatever we want to do. I think all of us want to feel our best. Let's take you or me for example. We want to be taking very challenging decision and with very good cognition even at 6 p.m. in the evening. We all want to have great energy throughout the day and we want to sleep like a baby in the night and get up next day morning like a very good energetic day. All of us want to do it, but I don't think all of us are in optimal health. We have a lot of scope for improvement. There are a lot of things that we can still work on so that we can feel our best. So I think all of us have that potential to work on these things, which could be your longevity lifestyle. You can adopt a longevity nutrition or evidence based supplements that we use in longevity medicine. So we could use all of us can be using all of these tools in the longevity kit and start feeling fantastic every day.
Got it. When I speak with people, they say that we know we have problems, and if we test, there'll be more problems, etc. We know we have to follow good diet. We know we have to strength train. We have to like build muscle. All of that we know, but we're not able to take action. So my question is, what insights do you give for individuals to change their habits? Did you see any success stories, of people who change their habits because of the longevity insights or because of the health insights that you've been giving?
I keep hearing this most of the time. Doctor, I don't want to do any additional tests because I'm afraid, I fear I could see more problems in my reports. All of us do fear that, right? But today we are at that stage of preventive medicine where we know that we are at risk for something, we predict something. There's definitely a preventive protocol for that, unless it's very, very acutely genetic that the reversal may not be possible. So when the science is evolving, when the data is evolving, when everything is evolving, and then we are not investing on our own preventive health, then we have to suffer with our own problems going forward later. We keep seeing our parents, grandparents. We see them struggle. We see them being very dependent. Once something hits, it could be their diabetes, it could be their painful knees, or it could be their overweight issues, or it could be their autoimmunity. We see all those problems, and we always have this thought: I don't want to go through that problem. Is there a solution for that? Yes, we here today in longevity medicine point of view, all of us have solutions for these questions, and we have power and ability to incorporate them. I keep hearing this all the time. Doctor, I want to know if my dad is having diabetes. I want to know if I'm at risk for, but I'm afraid to test it because I may have it. But in fact, I think all of us should be empowered with the news, empowered with the report, empowered with the data, empowered to know what we are at risk for because we can take action starting from today. Sadly, in late 20s, early 30s, I've been seeing people having metabolic dysfunctions. They're metabolically very inflexible. They're at risk for osteoporosis, they're at risk for diabetes, hypertension. When I see that all these can be preventable, then why not? If something can be preventable, who doesn't want to invest their time and energy in focusing on these things, right? I think rather than fearing things, it's important because there are a lot of studies. If you see, people who get tests done are their behavior changes. They want to do things better because they want to see their reports better. So the chances of adhering to the given plan of action is very high. Unless you know what to act on, you will not show a change unless you know something which is not tested can't be addressed. We can't do a guessing game. um, Something which is tested can be optimized, can be corrected, and we can definitely show changes. Let me give you one simple example of a 27-year-old male client. When he came in, he didn't have much of the problems. He just said, my father had early onset of cancer. I don't want to go through all that. Otherwise, I'm pretty fantastic. I smoke once in a while. I take alcohol once or twice in a month with my friends. The client sleeps around 1 a.m. or 2 a.m. in the morning, wakes up around 8 a.m. in the morning. So these are the few things that he clearly
Relatable
mentioned,
stories.
right?
Yeah.
Then we got his panel done to assess his hormones, oxidative stress, inflammation, nutrition deficiencies. And surprisingly, you will see the areas of concern are so many that we could address so many things. And today, what is the side effect of all those changes? The client lost weight, looking fantastic, skin is glowing, have less complaints of how often the body aches and pains, and feels great energy while he's playing a sport. If these are the side effects, who don't want to do it? Then what are the problems that we have identified? He simply had vitamin B9, B12 deficiencies, suboptimal testosterone levels. That is because lack of sleep, because all those men in that age group can think, I will get away, I'll sleep only few hours, work throughout the night, and I can get away with it. But what is the ultimate result? He had higher prolactin levels, lesser testosterone levels, which will make him put on more weight. But now he sleeps on time, doesn't compromise on the sleep time, and you see that his metabolic set point is so good, and he has been off the program and still following the longevity guidelines, principles, and nutrition, and still keeping that extra weight off. But what was the ultimate agenda? Was that to lose weight? No. It was simply for him to feel better. It was simply for him to reduce the risk of cancer that his family had. So we could reduce his HOMA IR from 3 to 1.5. We could reduce his fasting insulin levels very well from 18 to 2.5. We could reduce his fasting glucose levels. We could improve all the vitamin levels. We could reduce inflammation. We could improve his testosterone levels. So I think pretty much, what does a person need? Better energy at the end of the day? If that is all they get as a side effect, why not?
So the probability of abandoning your gym membership will come down if you know better, if you have better longevity insights.
I think if all of us have better longevity insights, we don't need to go to a doctor.
Awesome.
Overall, to summarize this, I want to say you could be in your 20s, 30s, or 40s. You still have a lot of scope for improvement. It could be improving your performance. It could be reducing that extra weight that is worrying you, or it could be improving your sleep, feeling better or best in the mornings. It could be reducing your family risk of cancers or metabolic diseases, or it could be your own risk of reducing a metabolic risk. I think these are few reasons why all of us should lead a longevity lifestyle so that we are not a burden to our families and we are functionally very independent. Hello everyone, thank you for watching this video. If you're looking for more content on longevity and how to optimize your health, please do subscribe to PMX Health to optimize your health at every age.